How to cope with someone who has depressive disorder. Dealing with a loved one who has depressive disorder can be challenging. The symptoms of depression can deeply affect both the person experiencing it and those around them. When someone you care about is struggling with depression, it can be hard to know how to help, especially when they may not want to talk or participate in activities they once enjoyed. However, offering the right support and understanding can make a significant difference in their recovery journey. In this article, we will explore how you can cope with and support someone who has depressive disorder. 1. Understand depression and its impact. The first step in coping with someone who has depressive disorder is to understand what they are going through. Depression is not simply feeling sad or down. It is a serious mental health condition that affects a person's thoughts, emotions, and physical well-being. Individuals with depression often experience feelings of hopelessness, worthlessness, and emptiness. Their energy levels may be low, making even simple tasks seem overwhelming. It's important to recognize that depression is not something that can be easily overcome with willpower, and it's not a reflection of the person's character. Key insight: educating yourself about depressive disorder can help you be more empathetic and patient. Understanding that depression is a medical condition, rather than a personal failing, can help reduce frustration or misunderstanding. 2. Offer emotional support. A person with depressive disorder often feels isolated and disconnected from the world. One of the most helpful things you can do is provide emotional support. However, it's important to approach them in a way that is non-judgmental and understanding. Listen without judgment, allow them to express their feelings, whether they want to talk about their struggles or just vent. Avoid offering immediate solutions or minimizing their feelings. Instead, show empathy and validate their experiences. Be patient, understand that it might take time for your loved one to open up about their emotions. Depression can make it difficult for them to articulate how they feel or to ask for help. Let them know you're there for them, whether they're ready to talk or not. Reassure them, let them know they are not alone. Offer comfort without pushing too hard. Sometimes, just letting them know you care and are there for them can provide a sense of relief. Key insight: sometimes, simply being present and offering a listening ear can make a big difference. Depressed individuals may not always feel like talking, but knowing that someone is available to listen can offer immense comfort. 3. Encourage professional help. While emotional support is vital, professional help is often necessary for treating depressive disorder. Encourage your loved one to seek professional treatment, such as therapy or medication. However, be aware that they may be hesitant or resistant to seek help due to feelings of shame or hopelessness. Gently encourage therapy. Therapy, especially cognitive behavioral therapy, CBT, or interpersonal therapy, IPT, can be highly effective in treating depression. Let your loved one know that seeking therapy is a sign of strength, not weakness, and that it can be a helpful step toward recovery. Discuss medication options, if appropriate. Talk to them about antidepressants, as they can be part of the treatment plan. However, be sensitive to the stigma that may exist around medication. If they express reluctance, offer to help them find a trusted healthcare provider or support them in making that first step. Offer assistance with appointments, if they are open to it. Offer to help them book appointments or even accompany them to sessions. Your presence can provide encouragement and help them feel more comfortable taking this step. Key insight: encourage your loved one to seek professional help, but be supportive rather than pushy. Reassure them that it's okay to ask for help, and offer assistance if needed. 4. Be patient with behavioral changes. Depression often causes significant behavioral changes that can strain relationships. A person with depression may withdraw from social interactions, they may stop participating in social activities or isolate themselves from family and friends. Lose interest in hobbies or daily activities, activities they once enjoyed may no longer seem appealing or possible due to low energy or motivation. Experience mood swings, they may feel irritable, frustrated, or indifferent, making interactions more challenging. It's important to remain patient and avoid taking these behaviors personally. The depression is causing these reactions, not a lack of care or effort toward you. Let them know that you understand, and allow them to move at their own pace without forcing them to engage when they're not ready. Key insight: Recognize that these changes are part of the disorder and not a reflection of how they feel about you. Offer reassurance and support, but give them space when needed. 5. Encourage healthy routines. Maintaining a healthy routine is essential for managing depression. While it may be difficult for someone with depressive disorder to maintain daily habits, small efforts toward self-care can improve their well-being. Promote regular sleep. Encourage them to stick to a regular sleep schedule. Good sleep hygiene is vital for mental health and can help improve mood and energy levels. Encourage physical activity. Exercise can help reduce symptoms of depression. Offer to go for a walk together or engage in an activity that is enjoyable and low pressure. Promote balanced nutrition. Eating regular, nutritious meals can have a positive effect on mood. Encourage eating well and staying hydrated. While it may take time for them to adopt these habits, being gentle in your encouragement and offering to participate together can help. Key insight: gently encourage your loved one to engage in healthy routines such as regular sleep, exercise, and balanced meals, but be patient with their progress. 6. Recognize the signs of crisis. In some cases, depression can lead to suicidal thoughts or behaviors. It's important to recognize the signs of a mental health crisis and act quickly if necessary. Signs that your loved one may be at risk include talking about death or suicide. If they mention wanting to die or feel like they would be better off dead, take it seriously. Increased withdrawal or isolation. If they are avoiding contact with everyone and seem completely disengaged from life, it may be a sign of crisis. Giving away possessions. If they are suddenly giving away their personal belongings, this could indicate a deeper level of despair. If you suspect that your loved one may be suicidal, it's important to get help immediately. Contact a mental health professional, call a suicide prevention hotline, or go to the nearest emergency room. Key insight: if you notice signs of a mental health crisis, don't hesitate to take immediate action. Reaching out for professional support can save lives. 7. Take care of yourself. Supporting someone with depressive disorder can be emotionally taxing. It's essential to take care of your own mental health while supporting your loved one. This includes setting boundaries. It's important to know your limits and avoid becoming overwhelmed by the emotional demands of the situation. Seeking support, talking to friends, family, or a counselor about your feelings can provide emotional relief and help you cope. Engaging in self-care. Make sure to prioritize your own well-being by engaging in activities that help you relax and recharge, such as exercise, hobbies, or relaxation techniques. Key insight: taking care of yourself is not selfish, it's essential for being able to offer effective support to your loved one. Self-care helps you maintain your emotional strength and resilience. Conclusion: supporting someone with depressive disorder requires patience, understanding, and empathy. While it may be difficult to witness the emotional struggles of a loved one, providing emotional support, encouraging treatment, and helping them maintain a healthy lifestyle can make a significant difference. Most importantly, recognize the importance of professional help and know when to seek immediate assistance if the situation escalates. By remaining a compassionate and non-judgmental presence, you can help your loved one navigate their journey toward healing.